The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest from Mercy Medical Center, Kathy Smithberger, physical therapist and administrative director of rehabilitation therapy services at Mercy Medical Center. Good morning, Kathy, and welcome to the show.
Good morning. I'm happy to be here.
After illness, injury, or surgery, some patients need intensive inpatient rehabilitative care, such as physical, occupational, or speech therapy. Such services are sometimes provided in the inpatient rehabilitation facilities. This morning we're going to talk with Kathy about the differences between inpatient rehabilitation services and skilled nursing rehabilitation, as well as explaining the services offered within the Inpatient Rehabilitation Care Center. We'd like to remind our listeners that our program is available on our podcast. You can search for Health Matters with the Medicine Center Pharmacy in the App Store of your favorite smartphone and take our program with you anywhere you go. We'll also have our programs posted up on our live Facebook feed, so if you have questions, you can post them up there, and we can address them as they come in.
So, Kathy, tell us a little bit about yourself and your role at Mercy Regional Rehabilitation Center.
Well, I'm the administrative director, so I'm over all of our outpatient as well as inpatient therapy services, cardiovascular rehab services, and also over the rehab unit itself, which is what we're going to talk about today.
Okay. So where is Mercy Regional Rehabilitation Center located?
It's located right in the hospital. It's on the 4th floor of the hospital. So that's wonderful because we can transfer the patients without bringing them outside. You actually get discharged from the acute care hospital and admitted to the rehab hospital, but it's all right inside the same building.
Super. That's really neat.
Okay, some inpatient rehabilitation facilities are within hospitals and some are in a building of their own. What are the benefits of having it in the hospital?
Probably the biggest benefit of having it in the hospital is it makes it a lot easier for your personal physician to continue to follow you. Or if you were seeing a hospitalist in the acute care side, that same hospitalist can follow you in the rehab unit also. When you're admitted to the rehab unit, you're admitted under our medical director, Dr. Ned Nafsinger, but he also encourages the other physicians to continue consulting, and so that's probably one of the biggest and nicest things. Other things that really help a lot is if you need radiological services or any type of testing, it's right there. You don't have to go outside the facility. We don't have to arrange transport. It can really cut down the time, which helps us make sure that we're getting the time you need in rehab also because you don't have that travel time.
We've had hospitalists on the show before, and I know this is sort of a new thing, has a large amount of physicians, shall we say, bought into this concept?
I believe so. I mean, there's still some private practice internal medicine physicians that follow their patients in the hospital, but I believe it's probably around 80% now. When you get admitted to the hospital, you're assigned to a hospitalist, and they really follow you. And it's nice because they're there, and they can catch all the consulting physicians when they come in, so the cardiologist, the neurologist,
sure.
And they can have those conversations with them to help promote the care and really kind of coordinate the care for you while you're there.
Okay.
And then when you're discharged, everything is sent to your personal physician so that they can make sure they stay in the loop. Any medication changes, all of that is sent directly to the hospital.
Sure, and I guess it gives the physician outside the hospital more time to see patients outside.
Absolutely.
Instead of visiting the hospital in the morning and in the evening and that sort of thing. So.
Correct.
Okay.
Can you tell us the difference between inpatient rehabilitation and skilled nursing rehabilitation?
Yes, and that's really an important distinction that I think a lot of times people don't understand because the acute care therapist will come while you're in the hospital and do an assessment of you. And really, they're looking at multiple things. How can you tolerate the therapy? Because in order to go to inpatient rehab, you need to be able to tolerate at least 3 hours of therapy a day. Now, that's not 3 hours straight a day. It's broken up. But you still need to have the stamina. Because some people, if you try to force them into that model, will actually deteriorate because you're just overworking the body and making them work too harder. When you go to a skilled nursing facility, that therapy is at a lesser intensity. You usually get about an hour and a half a day. Could be a little less, could be more. But the type of therapy you're getting is similar, but the intensity. Also the specializations. Usually in the skilled nursing facilities, it's more general, whereas on the rehab unit, we're used to seeing more patients with strokes, more patients with head injuries, spinal cord injuries. So it's a little bit more specialized when you come to the inpatient rehab facility. It also goes beyond just the therapy. Also, it's the medical management that you get. In the skilled nursing facilities, the requirement is that the physician see you once every 30 days. Whereas when you're in the inpatient rehab facility, you need the medical needs that require a physician to see you daily. At least 3 times a week is the minimum. Dr. Nafsanger at our facility rounds daily. Even on the weekends, they have PAs there. The difference is also the nursing care that you are given. On the rehab unit, again, higher level of care, so there's a higher need for RNs. We usually we have a 20-bed unit, and we staff anywhere from 2 to 4 RNs per shift, depending on the census. And at the nursing home, it's a less ratio.
Now, do outpatients come to the hospital?
They do, but not to the rehab facility. It's actually on the same floor, so it's just down the hallway. Okay. And that's also another nice thing about if you come to our rehab and then progress to our outpatients, those therapists can talk. They can, help you get that continuity of care. So you're getting the continuity from the acute care to the rehab to the outpatient.
But there are other Mercy facilities
absolutely
around.
Yes. We have 7 locations. We're at North Canton Stat Care, the Jackson Stat Care. At the newest one is over in Massillon, Tusk, Carrollton, and we're up at Lake. They don't have a Stat Care there, but in the high school, they have a physician's office, lab radiology, and the therapies up at the Lake facility as well.
Interesting. So you got a lot of choices.
Absolutely,
okay.
Yes. And that's one of the things that we do try to promote is that, we can provide the services right in your, where you live, in your community.
Closer to home is a good option.
Yes,
especially
always.
For people if they're struggling getting around.
So what do you mean by better outcomes in inpatient rehabilitation as compared to skilled nursing facility?
Well, there's been some studies out there that show with the inpatient rehab, when you look at after they've been discharged and they look at mortality rates, the likelihood of how long you're going to live after you've had a stroke, and those type of things, you have better mortality rates coming out of the rehab. Return to community or living in the home, that there's a higher percentage of our patients that return to home versus having to go into an extended care facility or something along those lines. And also hospital readmission rates are lower for those patients that come to a rehab unit versus skilled nursing facility. Now, part of that is, obviously the sicker patients tend to go to the skilled nursing facilities with chronic diseases because they can't tolerate the intensity of therapy. But I think it's also when you come to the rehab unit, the inpatient rehab, you're probably looking at a maximum 2-day stay, or 2-week stay. Whereas when you're going to a skilled nursing facility, you're usually there for closer to 30 days. So you're in that institutional setting a lot longer. The opportunities to pick up an infection, not being in your home environment and all of that tends to have some issues also.
So it appears that more and more nursing facilities are are putting in
rehab
facilities.
Yes, I mean that there's, as the population ages, there's more and more people that need those rehab facilities, and all the skilled nursing facilities, they provide excellent rehab services. It's just a matter of the intensity and the goals at those different facilities with what you can achieve. And I think where the rehab facility benefits you is you can get that intensity of therapy, and so the recovery is a little bit quicker.
Okay. Our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Just in, a new truckload of great merchandise at the Half Off and Out By store in Louisville. You'll find Hamilton Beach appliances, suntan products, beach towels, swim toys, shampoo, skin care, super prices on Crest toothpaste, Starbucks coffee, candy bars, electronic accessories like buy one, get one free, back to school, girls and ladies Levi's, and lots more. Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. See us on Facebook or halfoffhotbuys.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paper whites, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Kathy Smithberger, physical therapist from Mercy Medical Center. So, where are we growing? Rehab.
Where are we growing?
Yeah. Where are we heading?
I think where we're heading is more technology. It has been amazing to me because I've been a physical therapist for 35 years now. So treating the stroke patient from 35 years ago, we kept them in bed for, weeks, tone issues, just debilitation. These days, if you have a stroke, it's not unusual that by the next morning you're getting up, you're in the chair, we're moving, and just the whole medical concept of going into the emergency room as soon as possible after a stroke. Because if it's a blood clot, they can give you medication that breaks up that blood clot. And I have seen, people that before would have been severely debilitated, losing half of their function on one side of their body or another, they have that temporarily and they can recover so much quicker. So I think the main thing is just we need to continue to look at ways to get them up on their feet quicker, because that helps prevent tone issues, bathing, dressing, all of that. Instead of having the nurses do it, it's focused on, okay, let's get you back to doing it, and getting the motor repetition so that your body relearns all of that much quicker.
So in the past, we probably didn't have much success in bringing a stroke victim. Okay, they stayed in bed.
Right,
We probably didn't have much. Bring them back in a very short period of time, or maybe never.
Correct, yeah. Or they, a lot of them went home and they were in a wheelchair, or, they needed 24-hour care. And we're seeing that change rapidly. A lot more, your function returns to the hand, so you can use a walker instead of a cane, which makes you a lot more stable.
Sure.
It makes you weight bear on both sides. We used to get that a lot of times, as you saw that person walking down the street and they kind of, swung that other leg along, but all the weight was on that good sound side, and you could tell from miles away. And these days, those patients, walking down the street, you don't know that they've had a stroke. And that's one of the things I have to tell people a lot now also is you had a stroke. You may have recovered really quickly, but your brain is still healing. And you may have some cognitive issues or some memory issues, or things just don't work as fast as they used to. And you need to give yourself a break and remind those around you that, you know what, I had a stroke just a couple of weeks ago. I'm still recovering from it. Because this is the way we are today. People expect you to jump right back into, what you were doing, and we don't give people the time to heal like they used to.
I have a couple friends who've had strokes, and one in particular who was pre-stroke was extremely knowledgeable about certain subjects, and in my discussions with him, he stops and he says, "I know this, but I don't know this.
Right.
I can't find it, in my brain." So ultimately, he recovers, and if I sit there long enough, and he does get it back, somewhat.
Right.
Okay.
But it's giving them the time, that they don't remember that. And I think a lot of times we miss sending them to outpatient speech therapy and occupational therapy because we think, they're fine. They're walking, they're moving.
Sure.
Well, they still need some help and rehabilitation techniques to help them gain those other skills back also.
Sure. Very interesting. So what do your regional centers do? Okay, let's face it, I would suspect that the hospital rehabilitation is far more sophisticated than what you're able to do outside. Yes, no? Maybe I said that wrong.
No, I think that the reason we kind of consider ourselves a regional center is that very thing. We have more resources. We have, we can consult other physicians more quicker, whereas if you're in some of the smaller communities, you're just not going to get that consulting. We have a wealth of therapists that, like I said, we have OTs that have low vision expertise, driver's expertise. We have physical therapists that has expertise in neuromuscular reeducation and that type of thing. Whereas you might get that at some of the smaller communities, or you may not, just because the physician or the therapists have to be more generalists than they can be, specified in certain things. And the same with the doctors. You're just not going to get those consults at the cardiologist and the gastroenterologist just because they're not available in your community.
So a person comes into the hospital emergency room and has maybe had a stroke. They think he's had a person's had a stroke. What's the first move?
The first move is they immediately fast track them to a CT scan. They're going to check that out and see what type of stroke, if it is a stroke, what type of stroke. Is it a brain bleed, or is it that there's a clot there? So if it's a clot, then they can immediately do the TPA. And when you get to the emergency room is extremely important. As soon as you start to have any type of symptoms, you need to get to the emergency room because they have a very short window of when they can do that TPA. It's 3. If they don't have that information within 3 to 4 hours, then they can't do the TPA, the medication that helps break up that clot. So it's extremely important for you to get there soon.
I thought we had a little bit more time than that, but I guess not on the TPA.
Yeah, it's expanding. The parameters are changing, so I think it is getting a little bit longer, but it's still a pretty tight window from the time you start having symptoms till when you can have that.
So it's not a universal therapy that stroke patient comes into the emergency room and you give them TPA.
Correct. Yeah, if you tell them that, well, I started having symptoms yesterday, but I started having that numbness and tingling in my face, and I couldn't speak well yesterday, but then it got better, and I thought, oh no, it's nothing. Then it's going to be too late to have that method of treatments. There's other medications and other things that they'll do, and obviously there's still advanced treatments, but you're going to lose out on that opportunity to have best state-of-the-art treatment.
You're listening to Health Matters with the Medicine Center Pharmacy.
Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paper whites, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Just in, a new truckload of great merchandise at the Half Off and Out By store in Louisville. You'll find Hamilton Beach appliances, suntan products, beach towels, swim toys, shampoo, skincare, super prices on Crest toothpaste, Starbucks coffee, candy bars, electronic accessories at buy one, get one free, back to school, girls and ladies Levi's, and lots more. Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. See us on Facebook or halfoffhotbuys.com. Incontinence. Nobody wants to talk about it, but many people have to deal with it. Hi, Paul White from the Medicine Center Pharmacies. We recently made a large purchase of underpads and adult diapers. Many brands are now in stock and all at half price. You can save many dollars by purchasing these incontinence products at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. We also have compression hosiery, many brands in stock, and all at gigantic savings. Stop into Medicine Center Pharmacies and save on all your healthcare needs. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing inpatient rehabilitation therapy with Kathy Smithberger. We've got a lot more to cover this morning, so let's get back to the show.
All right, Kathy, what type of patients do you see on the rehab unit? You mentioned stroke patients already. I'm sure that you see a wide variety of patients that have suffered certain ailments or complications.
Correct, yes. It really is a wide variety. We see patients with a lot of neurological problems, so they may not have come into the hospital because of their multiple sclerosis or their Parkinson's. They may have come in because they had another illness, but because they have those diseases, it makes the recovery more difficult. And so we'll admit those patients to the rehab unit, or they may be newly diagnosed with the Parkinson's, the multiple sclerosis, any other neurological impairment. car accidents, multiple traumas, falls, people with hip fractures, like I said, closed head injuries, those type of things are patients that we see. Also amputees, people that have had problems with, diabetics that get in trouble with their feet and have gangrene and have to have an amputation or a traumatic amputation also. We'll see patients there. And then we also see patients with general debilitation. They came into the hospital. They were on a ventilator. They had a prolonged hospital stay, multiple medical problems. Those patients a lot of times will need that extra time to get up and get moving again.
Before the show started, we talked about changes in healthcare and how the only constant in healthcare is change.
Absolutely.
So, I get the impression from talking to patients and even listening to our own insurance carriers that many patients are encouraged now to shop around for care. Mm-hmm. So how about you give our listeners some reasons that they should consider choosing Mercy for Rehab inpatient care because of the program you have to offer and what the benefits are?
Okay. Yes, that is a constant struggle, especially these days with copays and deductibles and authorizations that you need to obtain. It does become a struggle with the different insurance companies. But I think some of the strongest things is our medical director, Dr. Nofsanger. He's a physiatrist. He has a strong understanding. He's been with us for over 30 years, I believe. He started way back when we had Dr. Rosenberg and him together. And then he was away for a while, and now he's back with us. And he has a strong understanding of what a patient needs medically as well as physically in order to get repairs. He also has a strong background in helping with pain management. And if the pain is really a barrier to discharge or a barrier into them getting better, we have our pain management at Mercy Medical Center, and those physicians can come and consult. And that can be a big thing, finding the right medications or the right way to manage that pain so that now you can participate in physical and occupational therapy. Those things are very strong. And our therapists have a lot of skills. We've got therapists ranging from having 35 years of experience down to new grads, and that's a great mix because we've got the therapists that have experience and have worked with strokes, amputees, all of those type of things for a long period, and then we've got the new grads that have the newest knowledge. They're closest to the research, and they can help update us and push us along to say, well, what about this, or how about if we change this? So I think our case mix of that is really important. We also have the added benefit of we've got, and this isn't just for if they come to our rehab, this is for any patient that has had a stroke or an amputee. We have support groups that our therapists are actively involved with and help manage. So we have a stroke support group up here at the hospital. We also have a stroke group down at our Tusk facility that operates out of that, and then the amputee support group. And those have more benefits than any of the therapy sometimes, because you can just talk to people that have experienced the same thing that you have went through the struggles that you have, and that can really give you that support that you need.
There's been some chatter lately in the news about veterans being able to choose their own healthcare site. Is that happening, or?
I think yes. I don't know all the details, but I do know that we are seeing more patients that from the VA. I know when we submit, I think they really are trying to look at, as we were talking before, about staying close to home, and if they can keep them in a facility closer to home versus them having to go up to Brecksville or some of the other facilities.
And that would be the closest, wouldn't it, Brecksville?
I believe so. That's the closest that I'm aware of.
Okay. I mean, we have a local VA clinic, but I don't think.
Right. If they need rehab or something along those lines, I think they would have to, if they're staying in the VA system, they would have to go up to there.
Gotcha.
So, yes, I believe that there's, I know we have to, make applications for authorization and that, but I think we are seeing more being treated locally.
That's good.
Well, you mentioned support groups. and you talk about rehab and physical therapy, and I think of all the help that the patient's probably going to need from their caregivers or their family. So what other common concerns do you hear from the family or support caregiver side of a patient that's in the facility with you guys?
And that is a large part of what we do on the rehab unit. We definitely, from day one, we're asking them, okay, who's going to help you out at home? How can we get them in here? How can we involve them in the therapy? We'll even do something as far as what we call a share care, where the caregiver can come in and practice taking care of the person overnight, for a 24, 48-hour experience with that. But yeah, we have wonderful social workers because it's not only looking at what do they need physically to be taken care of at home, but what emotional support. Like yesterday, I was just talking to somebody. Her husband has had a severe stroke, and she still works part-time. So, we had to go through that. Well, if he goes home and needs 24-hour care, are there other family members? Who do we need to educate? Can we get him home at a wheelchair level because they live in a 2-story house? So, talking through that process, and she was great. She had already talked about how, okay, she was going to move a bed down into the dining room and the bathroom is close by, but then we need to take it that next step because you don't think about that. Okay, do you have any steps to get into the house? Are we going to need to ramp that? Is the bathroom big enough to accommodate a wheelchair? Yeah. So, going through and walking through all those steps, both our physical occupational therapists help with that, but really the main backbone of that is our social worker on the rehab unit. So you actually make
a visit to the home?
At times we can. Not every patient, but if we anticipate that is going to be a big issue, we will take the patient out to the home and just walk through and trial things. Yes.
Okay. Very interesting. So what do you do to ease a patient going home? I mean, I can't, if they're in a wheelchair or if they're...
Yeah, we try to simulate a lot of things for them. Obviously we don't take everybody home and we can't get everybody in the exact situation. Mm-hmm. But probably one of the first things we ask them when they come to the rehab unit is, what is your goal? I think that's probably the important thing is asking the patient, I can look at a patient, I can evaluate a patient, and I've got it in my head what I think their goals should be. But it really comes down to the nursing staff, the physicians, the therapists, really asking that patient, what do you want to get back to? What's most important to you? And it's funny, a lot of times we think, getting back to work or getting back to this, level is, and sometimes they'll say, you know what, I really don't care about that. I just want to be able to get home where my dog is, and I want to be able to interact with my dog or my grandchildren.
Excuse me.
Baking is really what I like to do. So how can I get back to, making those Christmas cookies that I always make or something like that? So it's really a matter of backing it up and saying, okay, what's really important to you? What do you want to do? Then we're going to break it down and we're going to look at it. How can we? Do we need to make some alterations in their home, make some accommodations? Occasionally we've got to say, yeah, I know you really want to do that, but right at this point in time, I don't think that's what we need to focus on. But most of the times, we can try to simulate things at home. We've got kitchens at the hospital, so we'll do baking, which benefits the staff greatly because we get really great baked products and meals from the patients and stuff. But it's nice to there's such a joy and a smile on their face when they can actually see, yeah, this is possible. I haven't lost everything.
When we have a program like this, I think to myself what my structure of my house is, okay?
Yeah.
And all the things that I do. I'm in and out. I like to go outside when the weather's nice, not come back in for a while, or I like to work in the garage, or I like to go to the basement, or I like to say it's a 2-story, so, bedrooms upstairs and stuff like that. And I think about, when I leave a program like this, I think about all the things. Now, what would I do? If I became debilitated and couldn't get up the steps or couldn't come and go as I wanted to go.
Absolutely.
And couldn't drive. Okay. It just, to me, it's That would be the worst thing that I couldn't drive.
And it is. It's a big deal for a lot of people. And that's why we've really focused on our driver program at Mercy Medical Center. Because her goal isn't to remove people from driving. Her really goal is to, okay, how can we make you safe driving and keep you that, especially in a community where we live, where, yes, we have the RTA and that, and it's a great service, but it's not the most convenient service.
Yeah, you can't get to some places you really want to get to easily,
right,
without a transfer.
Right. Or if you have mobility issues, if you're dropped off even a half block down the street, that doesn't help you a whole lot and stuff.
Interesting. I know you've been on the program before. I know we've had other individuals on the program that have paralleled, what you do, and that's one of the first things I think of as I age is, what would I do if I couldn't?
Oh, yeah. Yeah, I've got a good friend right now. A relative's family member had a brainstem stroke recently, and I've been watching her progress in a rehab facility and all of that. And they're at that point where they're talking about taking her home. And, this is a person that's dependent on everything and just the changes you have to make to your home. But, as many of our families locally with our current patients, they're willing to make those steps. So I think, that's where the rehab units are very beneficial because we can give them advice and say, you know what, you can take them home. It's going to be a lot of work, but here's the things we need to do. What is reasonable and what can we do successfully to help get you there?
I look at, more and more homes have ramps, than we've seen in the past years. And I find myself looking at those ramps and thinking, now, how do some of those people get up those ramps? Okay. Because they're not in a motorized wheelchair.
Right.
I would suspect most of them. And some of those ramps have been constructed in sort of a...
straight up.
Yes,
way.
Straight up. And I'm thinking, this is a challenge.
Well, yeah, and it's not always possible, but really when you're building a ramp, the parameters are for every 1 foot of rise, you need 2 feet of run for it. So when you're building something like that, a lot of times that's why you'll see the ramps that kind of zigzag back and forth, just because they know if you put it straight up, you're not going to... Yeah. It's not doing you a whole lot more help than the steps are.
Yes.
Because you can't get up them. So, yeah, that's the general rule. For every 1 foot of rise, you need 2 foot of run.
Of run. Okay.
Yeah.
All right. That's interesting. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. Health Matters with the Medicine Center Pharmacy.
Just in, a new truckload of great merchandise at the Half Off and Out By store in Louisville. You'll find Hamilton Beach appliances, suntan products, beach towels, swim toys, shampoo, skincare, super prices on Crest toothpaste, Starbucks coffee, candy bars, electronic accessories like buy one, get one free, back to school, girls and ladies Levi's, and lots more. Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. See us on Facebook or halfoffhotbuys.com. Incontinence. Nobody wants to talk about it, but many people have to deal with it. Hi, Paul White from the Medicine Center Pharmacies. We recently made a large purchase of underpads and adult diapers. Many brands are now in stock and all at half price. You can save many dollars by purchasing these incontinence products at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. We also have compression hosiery, many brands in stock, and all at gigantic savings. Stop into Medicine Center Pharmacies and save on all your healthcare needs.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today, and let's get back to the last part of the show. So, how about some successes?
Yeah, we have lots of those. Those are always the ones that you remember the most. And as we were talking about that during the break, I was trying to remember, okay, come on, you have a bunch of them. And one that pops into my head that I worked with her, it was probably... Yeah, her oldest kids are in their 20s now. She was in a car accident over in Europe and suffered a spinal cord injury. And she came back and we did rehab with her on the rehab unit and then outpatient. And at the time, her goal was to walk down the aisle for her wedding. Oh, wow. And at that time, she was working with the exoskeleton braces and everything, and that was when it was early on in these braces, and there wasn't a lot to know. But we worked it out, and we were successful in being able to get her to be able to walk down the aisle. Now, she still, to this day, uses her wheelchair mostly, but it has not slowed her down. She's had 5 kids, all very successful, and, she was able to manage it all. And she still comes in for outpatients periodically for, just checkups and to work on some things that she's worked on. And obviously, since having the kids, walking isn't a priority anymore. It's just being able to keep up with those kids and do those type of things. And like I said, some of the biggest success stories we've had recently is with our stroke patients, just because we're so much more aggressive with them, even down in the ICU with getting them up. Getting people back to ambulating without an assisted device, getting back home so that they can do everyday activities, and returning to work. There's a lot of people these days that, they think there's no way I'm going to return to work. And, with a lot of hard work on their part and a little bit of guidance from the therapist, they're able to get back to work really successfully.
We had many factories years ago in this area that employed people who were confined to a wheelchair or even blind. I knew a fellow who was blind and used to ride the bus with him, and he did a repetitive thing at the Hoover Company in North Canton. Worked there for years.
Yeah.
Built the garage, wired the garage, just all kinds of stuff. So just amazing what you can do if you have to, or if you're driven to,
And that's half of it. Just having the support of people around you, as well as having that positive attitude of, what, I may be dealt a bad break, but I'm going to make the best of it and figure out a way to do it. For most of the patients, they're able to do that.
We're getting a little short on time, and we may have covered part of these 2 questions. Like, we understand there's several different types of therapy at Mercy's Rehab Center, and we may have talked about that to some extent. And also, what exactly is physical therapy?
Physical therapy is our main focus is returning you to your prior level of function. That maybe you've had a back injury, a neck injury, a medical complication such as a stroke, an amputee. Physical therapist is going to assess you and look at what tools they have in their toolbox to help you either decrease the pain, increase the strength, or find another alternate route to do it. So it can be anywhere from, like I said, a shoulder strain all the way up to somebody that has had a spinal cord injury and needs to return back to work. Occupational therapy, their focus is more on what we call activities of daily living. So you're bathing, you're dressing, just problem solving throughout the day and what you're going to do. So they're a little bit, they cross in between from over to the physical as well as cognitively, how you think through things, how you just process things and work on helping you out with those. And then speech therapists are, obviously they're working with, your vocabulary and your speech, and that's kind of the thing you think of the most with speech therapists. But they also work with the muscles of your throat, so swallowing, breathing, all of those type of things they get involved with also. So they deal with the cognitive as well as the physical components of speaking, eating, chewing, and all of those things with it.
How about electrical stimulus? You see all this stuff on television where there's electrical stimuli to make your muscles work. And is that common or?
It is in several different ways. We use electrical stim for pain. So you hear people with about 10 units, those type of things, where you're putting an electrical impulse in to kind of trick your body into feeling another sensation and you forget about the pain. Or to decrease muscle spasms. We use the electrical stim to help decrease muscle spasms with that. Then there's the electrical stim where it actually facilitates muscle contractions when you use a different electrical. And that can be helpful if the muscle's too weak for you to be able to activate it. We can use that stim to help
start make it work.
Yeah, and then you can
make
take
it
over.
exercise itself.
Right. Okay. And then there's really the new components out there of with people with spinal cord injuries where they're implanting the electrodes and it's taking over for your body's function.
Thank you very much, Kathy, for coming today.
Appreciate it.
We enjoyed the show. Kathy Smithberger, physical therapist, administrative director of Rehabilitation Therapy Services at Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your health care provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass. We thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.